This is the final report of findings on Reed's case number 631. It will be in two parts. First part will be the mesial root, and a later part, part two, the distal root, will be posted after this part. These are the radiographs we posted in the preliminary report. It's a lower second molar with a large periapical lucency, and Reed's diagnosis form indicates a large restoration and lucencies around both the mesial and distal roots, and he makes note of a probable fracture. His MTI testing form indicates negative for symptoms, and there is no chief complaint. The diagnosis is necrotic pulp and asymptomatic apical periodontitis with a guarded prognosis and an alternative treatment of extraction. His consultation notes mention that the patient is a bruxer and that there is a distal crown fracture and a mesial resin restoration. Treatment was started on August 7th and extracted August 7th after a vertical root fracture was suspected. The treatment form records all canals were necrotic and all instrumented out to a master apical file of 25, except the mesial lingual, which was instrumented to a number 15 at the terminus. The irrigation method was recorded in the notes as shown here, utilizing a Fotana Laser sweeps technique, as shown in this note. Sodium hypochlorite and EDTA were the irrigants used according to the sweeps protocol. Reed allowed the tooth to soak in bleach for 10 minutes just prior to the extraction. I received the tooth in formalin and examined it carefully. No root fractures were detected in the areas examined. The tooth was sectioned off and photographed from both the axial and coronal directions in an attempt to detect the root fracture. None was detected. Photographs were taken of the deep access in an attempt to detect vertical floor fractures or fractures stained along the mesial and distal walls of the prep. None were detected. The coronal view was stained with tellurine blue, and again, no fractures were evident. Photographs of the mesial and distal crown surfaces were taken in an attempt to detect fractures, and only slight enamel fractures were visualized, even using stain. The coronal crown section correlates with both my radiographic as well as treatment form that the ML canal had much less instrumentation, not only apically, but also coronally, and correlates well, as you can see in this comparison. These are the photographs of both roots after separating them, and again, no vertical fractures were detected. There did appear to be some resorption around the distal apex. Now I'd like to play a section of the video from the Fotana website, giving a cartoon animation of how the laser debrides the dentinal wall of biofilm. And then when you look at a few of the scientific papers, they mention that their SEMs use teeth in a jar samples with apical instrumentation out to the standard 55 file, and their SEMs show the tubules to be fused by the laser in the one SEM they showed. In another paper, they didn't use teeth in a jar, but instead a glass root canal model filled with paste and distilled water, and attempted to measure what they referred to as the debris removal rate. This video will look at the mesial root, and the next posting will review the distal root. When the root was split sagittally, it appeared the mesiobuccal canal, the one with the larger instrumentation, appeared very well debrided of tissue, but the mesiolingual canal, the one with minimal instrumentation, had a great deal of tissue remaining. Looking closely at the mesiolingual canal, we see what appears to be hematogenous tissue in the segment where the terminus was captured. We see some kind of pulp tissue all the way to the terminus. If you recall, the largest apical file used here was a 15. When you examine the area where the canals coalesce and where there appears to be pulpal tissue, we're going to ignore this tissue for a moment and examine places where we might get a glimpse of the mineralization front on the dentinal wall. And when we examine that, we see what can only be interpreted as a biofilm with many bacterial morphotypes. In the adjacent area, you can infer this is just part of a much larger and widespread biofilm interspersed with debris from the demineralization of the predentin. It is true that this biofilm does not look healthy, and many of the biofilms look like they've been in a war or at least a hurricane. Further coronally in the mesiolingual canal, it is pretty much the same story wherever you look. And again, it looks like the biofilm does not like the environment they have been subjected to. We have no way of determining from the imaging whether these are viable biofilms or not. All we can say is they do not look like biofilms one sees in conventional irrigation cases. In the mesiobuccal canal, looking at the terminus area, where it appears the instrumentation has been much more definitive, the canal wall is clearly seen and appears very well debrided. You can go into certain areas like this and detect biofilm morphology, but generally speaking, the dentinal wall looks very clean, although you have to look hard to detect any dentinal tubules. So I infer there has not been a lot of demineralization. The next video will discuss the distal canal, and there the picture is slightly different.